CARPHA is a consolidation of 5 regional institutions into one agency. These institutions, some of which have been in operation for about 50 years, they deal with epidemiology, food and nutrition, environmental health, drug testing, as well as research. But CARPHA came into existence because of several reports which indicated that there was need to restructure the public health system. And CARPHA was agreed on by the heads of government as the best formula for bringing together and making an impact and serving the public health agenda of the region.
Well, CARPHA is, currently there are 3 public health labs in the region. There's the lab at the Caribbean Epidemiology Center, CAREC. There's also a lab at the Caribbean Environmental Health Institute in St. Lucia, and the Regional Drug Testing Laboratory in Jamaica. CARPHA, in effect, will be taking on the responsibilities of these 3 labs. And currently, we have established a special laboratory advisory group comprising not only of technocrats from within the region and also a PAHO representative in that area, but also have involved representatives from CDC, from the Public Health Agency of Canada, and the United Kingdom Health Protection Agency in an effort to look at trying to make it the most effective and efficient lab that we could have to carry out these functions. It is going to be the main focus of activity, so to speak, of CARPHA. And so a lot of attention is being focused on the development of the lab. We've identified the functional requirements for the lab, and we're going through the stages in terms of preparing the pre-designed briefs, etc., etc. The government of Trinidad has graciously offered to host this CARPHA headquarters and indeed the CARPHA lab, and they have given the go-ahead in terms of making plans because, incidentally, they're also looking at constructing their national public health lab at the same time in the same area. So it will be co-location of 2 labs, and the government of Trinidad and Tobago will be undertaking that in terms of the planning for that activity. It is anticipated then that this lab would not only focus on servicing the needs of the CARICOM countries, but indeed the wider Caribbean, the French islands, the Dutch Antilles. So it is expected that CARPHA will do much more than is being done now currently by the RHIs.
First of all, for economy of scales and for synergizing the efforts of small territories. For example, in the effort of laboratory services, instead of having the services splintered, you're having them come united. And at the same time, for leveraging support for from funding agencies and partners. More and more, it is happening that partners and sources of funding are wanting to deal with larger entities rather than small, fragile economies. And it makes sense, instead of having your services splintered across 14 territories, that you consolidate your effort, synergize your efforts, and that's what we're all about. This was a bold step taken a few years ago, and it attracted limited support initially. Their core foundation partners were, for example, the PAHO, the United Kingdom, and of course the Public Health Agency of Canadian Public Health Agency. What we've noted over the past few years, because of the power of the idea, the logical nature of the idea, the effort to consolidate these 5 regional institutions, more and more partners are coming on board, and even countries now who were somewhat distant from the Caribbean, like Brazil and Argentina, they're now coming on board and offering support. So the idea now is taking full and firm root, and we're hoping to have this up and running officially by January of 2013.
2 of the 5 institutions are PAHO institutions, the Caribbean Epidemiological Research Center and the Caribbean Food and Nutrition Institute. And CARPHA, in fact, having been established and having been recommended as the way to rationalize the public health agency, depended a lot on CARPHA's technical assistance leadership. And indeed, because CAREC is the largest of the 5 agencies, it was important for the PAHO to be on board with the design and the development of the strategies to achieve CARPHA. Well, PAHO has been exceptional. They have provided much of the seed funding to support the organization of the Office of the Interim Director, and before that, the project manager. They have provided the technical assistance that allowed us to do a lot of the work related to the subcommittees, the laboratory committee, the finance committee, the human resource committee. PAHO has put its resources in terms of human resources and expertise to work along with the interim director of not only in laboratory but also in fashioning the human resource program and dealing with the transition of staff. But more importantly, I think that PAHO has demonstrated that even when the countries and the programs and the institutions are merged, that it will continue to support its development. It has committed. And in fact, sometime over the weekend, the director will be signing a CARPHA PAHO agreement to that effect. And so what I want to say is that PAHO has been in on the beginning. It helped to create many of these agencies. It supported them. And it seems like it's going to be there not only at the end, but to help to continue the process.
Now we're having a recognized epidemic of non-communicable diseases, childhood obesity, the chronic diseases. Those are things that we have to start addressing as a region. We've done exceptionally well in regard to the struggle against HIV/AIDS, along again with international support, particularly from PAHO and the U.S. administration, a lot of American funding to help in the fight against HIV/AIDS. Now it's recognized that we have an epidemic right across the region, and those efforts need to be strengthened to address these issues. If I were to answer your question exactly, what are some of the health concerns in the region? And of course, the region is prone to disaster, right? Fortunately for Guyana, we don't have hurricanes or earthquakes, but we have flooding, perennial flooding. Those present continuously public health threats to the populations of these territories. So we need to have in place the emergency response, and that takes time to build up. And this is one of the major efforts to bring these 5 institutions, some of which have served us well for 50 years or more, and to bring them together as one strong force to provide a public health umbrella under which we can address such issues as disaster preparedness and so on, laboratory service needed for the support of such services and so on. So I think this is one of the major achievements. We're bringing these small entities together. And at the same time, we've been able to attract more and more support from more and more partners in this effort. Shortly, sometime in November, I think around October the 23rd, there's going to be a meeting in Miami of another set of stakeholders, another set of partners who are willing to come together and bring their expertise and their financial support to CARPHA.
If I may, there's another area of importance, surveillance, and it follows on to what the minister said in terms of the surveillance of the non-communicable diseases. But also, I think you'll be aware the WHO, I think it was 2 years ago, focused on injuries and violence. And there's a lot of that in our region, and it is a need to focus on that in terms of surveillance, not only in terms of surveillance, but coming out of that, looking at preventative mechanisms, and it's expected that that CARPHA will deal with this because it has been a gap in the provision of public health services in our region especially. And also, injuries and illnesses, job-related, these are things that we have neglected in the past, and there needs to be a focus on them. And of course, the emerging diseases, re-emerging diseases like tuberculosis in association with HIV/AIDS, and also the new communicable diseases that are now endemic in the region. So these are also areas that CARPHA will address.
I would say I want to just focus on a very important function of CARPHA that we shouldn't neglect. that is the research and development function. We have within CARPHA a particular unit to address research, but the research program really would galvanize what you will call the public health researchers together with the other scientists, social scientists, because invariably to deal with the things that both Minister and Dr. Walcott referred to, they require the merging and the blending of clinical and behavioral science. And therefore, more and more, the trajectory of public health research is dealing with that blend. And I think when we listened at the meeting and the programs and the plans for research, it is very important to note that that would be a really important dynamic. But together with the research, it not only involves just the policy research, but it involves training and expanding the public health leadership in the region. And in so doing, it's important for you to note that the entity that will coordinate our research, the Caribbean Health Research Council, it has a history of over 40 years of scientific meetings, which the meetings bring together expertise from all over the world, so that would be a good link between CARPHA, the national resources, public health leadership, and the international scientific community. So CARPHA is branching out in different fronts and will definitely make an impact in that arena.
Now, from all of this being said, obviously resources will be needed, and especially since, as the panelists here have just explained, there's a need for expanded services. And today's meeting, which was the fourth, the third meeting of partners, people who are part of agencies which are partnering with CARPHA to provide funding and other support. That meeting explored certain innovative approaches to funding. For example, interactions with the Caribbean Tourista Organization. They too have a vital interest in knowing that they have a safe destination, a destination to which thousands of tourists, not only Caribbean citizens, need protection, but thousands of tourists and other visitors, which activity affect directly the membership of the CTO. That organization has an interest in seeing that the Caribbean is a safe, healthy destination. You have to have the watchdogs, as it were, the gatekeepers of the public health functions, and that is where CARPHA comes in, has strengthened CARPHA, and of course the funding. The governments who have been funding so far, the separate 5 entities, are committed to continuing at the same levels of financial support, financial and other support, while at the same time the executive board is fashioning new approaches to leveraging finances. For example, it's not excluded that certain agencies might want to fund scholarships to develop capacity for the new entity. And of course, those are ways that they can support the institution, the evolving institution, and today the meeting explored such new and innovative ways of financing, while at the same time relying on the core pot of money, as it were, from the governments who previously supported the 5 independent agencies.